Budget cuts and possible policy changes in Montgomery affect a variety of departments and programs across our state. Zelia Baugh is the Commissioner of the Alabama Department of Mental Health, and she's here to tell us more. Ms. Baugh, thank you so much for taking time to be with us today.
Thank you for having me.
It's our pleasure. You have been a very busy lady lately, haven't you?
I have, yes.
You've been touring around the state. You've been talking to different organizations and groups and people who have concern about how the budget is affecting your department. Tell us about that.
Absolutely. We've had, since October, 15 regional town hall meetings throughout various parts of the state, and we've been using those as an educational opportunity for the new legislators that are now in Montgomery, as well as educating our advocates and our consumers on the importance of funding and what that funding means to them in their everyday lives, and the importance of advocating for funding for the department, especially coming up in 2013. We've had excellent turnout. The response has been very positive. It's been a lot of travel, but it's also been an opportunity for me to hear directly from the people that we serve what we're doing well, where we need to make improvements. And so that's something that I'm always eager to learn about so that we can make things better for the people for the state of Alabama.
Well, since you've been out on the road and you bring it up, what's your report card looking like? Are people happy whenever you come in to see them? Are they unhappy with you? What's happening?
I think I think people are happy that things are moving within the Department of Mental Health now statewide, and they're beginning to see some of those changes. I think the biggest frustration that I have heard throughout has been barriers to access to treatment. For individuals with substance abuse problems, mental health issues, as well as intellectual disabilities, because we have waiting lists for all of those consumers that we treat, and because of funding challenges, we are not able to treat everybody who truly has a need, unfortunately. And so access to treatment, timeliness of treatment, quality of treatment have all been things that I've heard.
As Commissioner, and we're about to enter into a new legislative session, what are your big concerns going into this session? Are there parts of your budget that you're just horrified are going to be cut, or do you feel pretty good about where you're at right now with the department?
Well, I'm concerned. I'm concerned because, and this is no secret, it's been in the media, a potential 25% cut in our general fund budget, which for the Department of Mental Health, that equates to anywhere from $29 to $39 million.
Wow.
And we use our dollars from the general fund as well as the special mental health fund in order to fund our programs and draw down federal dollars. So if you look at a $30 million cut to the Department of Mental Health, it's really a $90 million loss to the department in revenues from the loss of federal dollars. It's terribly concerning to me because we will have to cut services to people in the community because we have our hospitals, and so unfortunately we aren't left with many options at this point, and cutting community services is absolutely the last thing that I would want to do. But when we're facing a 25% cut, there aren't a lot of other options right now, and so my goal is to educate the legislators and educate the budget chairs and anybody else that's willing to listen at this point the impact of funding cuts to the Department of Mental Health, because it's a domino effect. You know, if our people have to return to the state hospitals, we're going to have to hire more employees, and so the actual costs of maintaining individuals in the hospital will go up, which could potentially be greater than my initial 25% cut.
And that was going to be my next question is, if you do absorb an almost $100 million cut this session, what does happen to facilities and jobs and people that are state employees right now through your department?
Well, if we're hit with 25%, it would have to come from communities, and we are legislatively, administratively responsible for taking court commitments in our state hospitals. We're talking about probably a few hundred individuals having to move back to state hospitals because their community resource is no longer able to maintain them in the community. So then, if they come back to our state hospitals, we will have to hire state employees to take care of the increased patient volume in the hospitals. And those incremental costs can certainly add up to the same 25% original cut. So one of the things I'm educating is we can pay now or we can pay later when it comes to cuts for the Department of Mental Health.
And possibly pay even more.
Absolutely.
All right. Well, Ms. Baugh, I'm sorry we're out of time, but thank you so much for being our guest today.
Thank
come
you.
back soon and
I
we'll
would
chat
love
some
to.
more.
Thank
I'll
you
give
for
us
all
some
y'all
more
are
time.
doing.
We could do 20, 30 minutes on
Absolutely.
this issue. You can find out more about the Alabama Department of Mental Health online at mh.alabama.gov or by calling 1-800-367-0955.